But you're talking about also the statewide nature of this in Rhode Island. Do you think it has that kind of potential in other states?
So the reason Rhode Island is such a great incubator for ideas such as this is that we're a small state, but we have a lot of the same issues that larger states have. In medicine, there's often like a major academic center that has the majority of resources and specialists and access to innovative technologies. And then there's a collection of community hospitals who provide excellent care, but just don't have the resources or infrastructures to support the services that the academic hospital has. And so it was really important to me when we were designing this program that it be implemented at any hospital within Rhode Island, because otherwise we're basically creating geographic inequity. So people should be able to access this no matter where they deliver. And we have been able to overcome countless obstacles to implementing the RI spheres at our community hospitals in Rhode Island that would provide a pretty clear roadmap of how to do this fairly easily in other states. Everything is done remotely, so the hospital contacts our team. We enroll the patient remotely. We follow them remotely. Each hospital has access to their own patients so that they know exactly what's happening within the program. We notify them when we make changes to medications. So even though it wasn't the primary aim of the grant, we really have learned how to operationalize and optimize collaborations with other hospitals.
Nice. It seems pretty straightforward to apply this in a rural setting, right?
Yes, I think that's where this program has the most power. So Rhode Island is not rural, but I did my fellowship in St. Louis, which had a 4-hour catchment area. And I think that is more representative of what obstetric care is like in the United States. And this program makes perfect sense because, again, everything is done remotely. So all you have to do is enroll or contact us. We can enroll your patient, and then we follow them and make sure you have access with clear communication as to everything that's happening. But yes.
Yeah, I've been reading a lot about the history of birthing hospitals closing across the country and different
Yes.
strategies.
Yes, and I think remote patient monitoring is a way to provide a temporizing measure to the obstetric crisis that we're having right now in the United States. I know that in some settings, more than half of birth centers in various states have closed due to funding issues, and that doesn't mean the patients are all of a sudden healthier or less at risk for complications. It just makes it harder to keep them safe.